Hello Malaysia and welcome back to Medical Today with me, Jared Ratnam. We just talked a little bit about eye strain, eyeglasses and technology moving forward. Coming back, we talk about cancer, the big C, something people don't want to talk about. It's the fourth leading cause of death in Malaysia, according to our specialists who are with me in the studio, in the flesh right now. We do have with us Dr. Aminuddin Rahman. He's a consultant clinical and radiation oncologist from KPJ Damansara Specialist Hospital. And also joining us in the studio is Dr. Azura Deniel. She's a consultant clinical oncologist, KPJ Ampang Putri Specialist Hospital. Thank you very much for joining us. It's a pleasure to have the both of you in the studio, but it's not a very nice subject to talk about. Now, when we talk about telling people they have cancer, I'm sure all of us, all of you had to do it for the first time. What was your experience like? We'll start with you, Doc.
Yeah, okay, thank you very much, Jared. I mean, it's a very pertinent question because obviously cancer is becoming very common in Malaysia and globally. Like you mentioned just now, is the fourth leading cause of death in Malaysia. So it is quite a devastating diagnosis for anyone, not just to the patient but also to the family. So obviously when we talk to the patient about the diagnosis, we have to do it very compassionately, caring. We do a lot of counselling. We explain to them that this is not a death sentence. Cancers are not supposed to be considered death sentences, depending on the type of cancer.
Is there psychology to doing this, to talking to people, in order to easing them into it, or to ease them into it, sorry?
Yeah.
I think it's really hard. Even after so many years, I still find it difficult, and we have problems with the family as well. Sometimes they tell us not to tell the diagnosis to the patient. Well, the first time I would say I remember is during my training, where we want to break the bad news to the patient. What we try to do with the consultant is to get everybody in the support system to be there together, so that when we break the news, we don't just tell them you have cancer, but we also tell them that there are things that we can do to help them to go through the journey.
Right. Now we have younger doctors coming into the system, and when they come under your tutelage or training, when it comes to talking to a patient, what do you tell them? Especially with cancer care, when you teach younger people, the 101 of speaking to someone, what's your basic advice that you give them?
We have to talk to the patient and the family compassionately. I mean, we have to understand, especially in the Malaysian socio-cultural background, there's a lot of differences in cultural belief system between the races.
Right.
We are not so open like in the Western culture. So we have to speak to the patient and the family compassionately, and we have to understand their sensitivities. And like Dr. Azura mentioned just now, talking to the patient and family with compassion and counselling, a lot of support and giving them hope. Right. I think it's very important to give these patients hope that there is a cure for cancers and it's not a death sentence. So these are some of the things that we touch upon during the initial consultation.
Yeah. Very interesting. Now let's just dial back a little bit and take a look at what the area of speciality the both of you have picked. So you are a radiation oncologist and you are an oncologist. What is the difference? Maybe you can start with your area of speciality, Dr. Azura.
Actually, I think both of us are clinical oncologists.
Yeah, right.
So clinical oncologists do both chemotherapy and radiotherapy.
Right.
There are other specialties under the medical side where they just do chemotherapy, and they are called the medical oncologists. So I think we do mostly chemo and radio.
So the work is very much the same.
Very similar.
Now, when we talk about cancer care / management, I mean, from 10 years ago and now, how much has that changed?
I mean, the oncology field has improved remarkably. That there's lots of new developments and discoveries. Nowadays, compared to 10, 20 years ago, we now understand the cancer at the molecular and the genetic level, where we can predict the responses to therapy based on certain genetic tests and all that. I mean, the field has come a long way. And lots of advances in this radiotherapy as well in terms of technology. Now you've got IMRT, IGRT, stereotactic radiosurgery, which we may touch upon later on.
Right.
In the field of drugs, we've got previously we only used to have chemotherapy, but nowadays we've got targeted therapy, immunotherapy, drugs that harnesses the immune system to target the cancer cells.
Right.
So lots of new developments, and it looks promising. So that is why, coming back to giving hope to the patient and the family, that there is a cure for cancer, even for advanced cancers where we cannot cure the patients. We can control the disease for as long as possible and convert it to be something like chronic illness like diabetes and hypertension. So these are some of the things which has happened in recent years in the field of oncology.
Right. Dr. Azura, coming back to you, when we talk about light at the end of the tunnel, do you see hope, in cancer treatment? Now, a lot of people say, when it comes to treatment, people just do it perfunctorily because they know, that the end result's not going to be good, but families still go through it. But of course, there are lots of success stories, isn't it?
Yeah, definitely there is hope. I would say that there's been an explosion in the developments of treatment for cancer. It's becoming more precise,
right.
And it's becoming more personalized. So very precise and personalized. So we also see the new treatment like immunotherapy, the use of our own immune system to treat cancer. And with this type of treatment, we do see long-term survivors.
Right. Dr. Aminuddin, when you talk about radiation therapy as an option to cancer treatment, when do you suggest, how do you know that this person needs radiation therapy, or how do you give them options?
Okay, so radiotherapy is a very important component of the management of cancer. We as oncologists, we treat patients with the non-surgical treatment, radiation and chemotherapy with drugs. We also closely work with our surgical colleagues, the surgeons, like breast surgeons, colorectal surgeons, head and neck surgeons, and then usually in most cases we will discuss with our colleagues about the optimal management of patients. So most cancers, these are the options of treatment: surgery, radiotherapy, and chemotherapy, either in sequence, combination, or alone. So it all depends on which type of cancer it is, what stage it is, the condition of the patient, the age, the performance status, fragility, and so forth.
Right. Dr. Azura, would you like to weigh in on this? We're talking about what the options people have as treatments, and when you pick radiation therapy, why do you pick radiation therapy?
So I think most of the cancers now are being treated with multimodality. So many types of cancers do need multiple treatments, including surgery, chemotherapy, and radiotherapy. So radiotherapy is more targeted to a specific area. So for example, breast cancer, there is an area that you can actually treat. So those patients may require radiotherapy, or like rectal cancer, or brain cancer or lung cancer. So it depends on the stage and the need for the multimodality treatment.
So when you talk about radiation, what are the benefits of radiotherapy?
Radiotherapy is a very effective form of a non-surgical form of treatment for cancer. Like we've mentioned just now, we treat a lot of cancers with either surgery or radiation, but the advantage of radiation is we can preserve the organ at risk or that we're treating, and we can clear the cancer. Let's say, for example, cancer of the larynx, voice box cancer. Patient commonly presents with
mentioning that to me.
Hoarseness of voice and
yes,
patient commonly present with hoarseness of voice, and it does affect the function of the voice box. So obviously one option is surgery, but if the patient undergoes surgery, either part of the larynx is removed or the whole of the voice box is removed, and that's it. Patient would have lost the voice, and we have to use artificial voice box and all that. On the other hand, we have this radiotherapy where we can treat the cancer, the voice box, and the cancer within it. We can clear the cancer, and also we can preserve the organ.
Right.
Meaning after the treatment, patient will have some side effects and all that, but after completing the treatment, once the cancer is cleared, we preserve the voice box, but we can clear the cancer. So that's the advantage of radiotherapy. We want to cure the patients from cancer. We want to preserve the organs at risk, and also we want to preserve the quality of life for the patients. The patient can go back to, the family and the career, right, and function normally.
It's interesting you mention quality of life simply because there's a lot of stories out there. You go to social media, there's a lot of shock, horror, and disbelief kind of stories that come along, saying that as soon as you opt for treatment in cancer treatment by big pharma, you are weakening the immune system. So many things are happening. Cells are dying. A lot of horror stories. What would you like to add in with regards to that, or dispel with regards to that?
Yeah. So actually, if you talk about the immune system, the cancer itself can cause weakened immune system, right, because the cancer may infiltrate into the bone marrow and cause the white blood cells that fight infections to be low.
So when it comes to the treatment, when you talk about treatment options, they say treatment options also will weaken your immune system. Yeah. Is that a myth, or is there any truth in that?
There is truth in that. Yeah. So both types of treatment, chemotherapy and radiotherapy, can weaken the immune system. But usually there are ways to overcome this. So for each individual patient, usually we will tailor the treatment according to their weight and height and the need and the area that is irradiated if we use radiation. And there are also treatment to overcome very low immune system by giving booster injections to improve.
Now, when it comes to treatment, when you're talking about radio treatment, what does the patient experience during radio treatment?
Yeah, so radiotherapy again is a local treatment. So basically, if you're treating head and neck or breast or the pelvis for prostate cancer, for example, there's another, not many people know the option of radiotherapy for prostate cancer, again as an alternative to surgery, where we can preserve the organ and clear the cancer and maintain the quality of life. So basically, patients undergo a daily treatment, Monday to Friday, for several weeks. How many treatments exactly will depend on whether the treatment is curative or to cure the cancer, or palliative to just to control the disease for advanced cancer. And radiotherapy is using what we call mega voltage X-rays. Just to give you an idea, the X-rays that we use for CT scans or X-rays is kilovoltage. So these are mega voltage, deeply penetrating X-rays, which can penetrate deeply and can kill the cancer cells. Initially, the patient will not feel.
Doesn't sound like a lovely Sunday afternoon, huh?
Yeah, so I mean, it does sound very mysterious or very scary, but to be honest, I mean, most patients will not feel anything initially, but after several weeks they will have side effects. Right. So cancer treatments are different compared to treating other diseases, where the treatments itself will cause side effects, but most of these side effects, like for radiotherapy, are temporary, are easily manageable, and are reversible. So like I said, eventually we're going to cure the cancer, preserve the organ, patient will go back to the family and career as a normal person. Yeah.
When we talk about therapies, like you said, mentioned earlier on, Dr. Azura, there are many options with regards to therapy. Now, which type of therapy has the greatest impact on one's immune system?
So I think the most extreme form of chemotherapy and radiotherapy. So chemotherapy, there are types that we give high dose.
You just scare us with megawatts. So what's the extreme form now?
High dose chemotherapy, where it rapidly ablates the bone marrow. So when you give high dose chemotherapy, this is more for hematological malignancies, leukemias, lymphomas. By doing that, you actually need to replace the bone marrow by doing stem cell transplant, and you regenerate the bone marrow. And also with radiation, there's this form of total body irradiation, where you give radiation to the whole body, and that will also deplete the bone marrow. And it's usually used as a form of treatment. Right. Under controlled conditions.
So while convalescing, while getting after treatment, once the treatment is over, can a person's life come back to normal? I think that's the more important question if you're talking about extreme radiotherapy.
Yeah, of course. I mean, the point of treating these cancer patients is to cure the cancer and also, like I've mentioned just now, preserve the organ, maintain the quality of life. Patient goes back to, the career, family, and society. So, coming back to the myths in social media about cancer treatment in hospitals, I feel it's a misinformation in the modern age. Previously, we don't have information, but now we've got misinformation because of social media.
Too much information sometimes.
Too much, and also misinformation, especially with regards to cancer therapy. And all the treatments that we recommend are based on high level of evidence where, we compare with the previous treatment and we try to get the patients better outcomes. And most of these, the side, of course, a lot of these treatments for cancer in hospitals, they have some side effects, but again, it's limited, it's reversible. I feel a lot of people in Malaysia, especially, they want a fast and easy treatment for cancer. That is why they go for alternative therapies.
We're always looking for that one pill which will
yeah,
cure
exactly,
everything.
exactly. So that's the problem. So and that kind of mentality is being promoted by this social media thing. So that's the challenge that we have at the moment, to educate the public, to educate society that our treatments are effective. Our treatments may have some side effects, but these are temporary and reversible and manageable.
Very interesting you say that. When you talk to patients and when you tell them about their options and what you plan to do, when you put together a treatment plan for them, do they say, look, I've done research on this study and this is what it says? Do they counter-argue sometimes?
Yeah, of course. We get second opinions, we get patients with family members from abroad giving us all these opinions and all that. I mean, we are open to that, but I mean, we are also quite familiar with dealing with these kind of issues where we've got more. I mean, with social media, with the internet, patients are also. I mean, the plus point is patients are getting more educated. Patients are knowing their options. Like for prostate cancer, for example, it's not just surgery. There's radiotherapy and other options. So there are plus points from the information from the internet and social media. We're open to that, but of course we discuss the options and let the patient and family decide what they are comfortable with.
You heard the saying, no pain, no gain. Right?
Yeah.
So sometimes we do tell the patients, you have to endure this, but in the end you do gain something about it. Yeah.
Dr. Azura, here's something interesting. Like when treatments are ongoing and the immune system is breaking down, what are the signs and symptoms of an infection due to, say, a weak immunity or weak immune system?
So the symptoms of infection are mainly fever. It's usually fever, sometimes associated with chills and rigors. So fever is usually of a worry when the temperature goes beyond 38 degrees. But if you have a weakened immune system, you tend to have you tend to be very vulnerable to infection. So any cough and cold around the house, you tend to catch it early and you catch it very frequently. And sometimes the illness is also more prolonged compared to other people and needs stronger treatment to recover from it.
Okay, saying if you have a patient, and I'm opening this question to both of you, and this person already has NCDs, has health problems already, say diabetes mellitus, probably hypertensive, so on and so forth. So how do you deal with that and the cancer and a weak immune system?
So usually when they already have multiple comorbidity, elderly patients, we also have to take that into consideration in deciding the treatment for the patients. So we do try to give something that is more gentle to these patients. But if they do have the treatment and have infections, then they are more vulnerable. Then the threshold to admit them to hospital, to give higher dose or more strong antibiotics is higher. And maybe they do need booster injections as well.
Right.
Obviously, just a take on that. I mean, we don't just treat the cancer. We treat the patient as a whole, and we consider the family and all that.
Right.
So the patients who are more fragile, elderly, and all that, we have to be a bit more gentle. I mean, there's a lot of myths saying that doctors give a lot of these treatments which cause a lot of side effects, and the patient becomes worse after the treatment compared to before. But nowadays, with all these new developments, drugs and new technologies and radiation, side effects are actually less, and we can actually treat, even elderly patients. There's some study recently showing that using lower dose of chemotherapy for elderly patients gives a similar outcome to using a higher dose of chemotherapy. So basically, all these new developments are making a difference for the patient and the family members,
right?
In terms of controlling and curing the cancer.
Right. I don't know if this is the latest in mosquito net technology. What am I holding? What am I holding?
Yeah. Okay. Okay. So this is it's called a thermoplastic mask. Thermoplastic mask, meaning when it's hot, it's pliable, it's soft.
Right.
So we can shape it according to the patient's. Say in this is a head and neck area that we're treating with radiotherapy. So when it's cold, it becomes hard. This is actually used commonly for radiotherapy treatments, especially like head and neck area, where we keep the position of the patient in the same position, and we do these markings, right. and using CT scans and MRI, we can actually target the cancer, very precisely with
so I guess, in what the both of you are saying, I guess we need to. I don't like blaming entities for this, but I think Hollywood, Bollywood, and Collywood, are to be blamed for the way they portray a cancer patient, and how the person goes through their life suffering, and it's not fun having being a person who's undergone cancer treatment, so on and so forth. Do you think what we see on TV is affecting the way we think about cancer treatment?
Yeah, to a certain extent, yes. But the other point that I would like to make is we are not talking about this cancer enough. Cancer awareness is still lacking in Malaysia. I mean, I train in the West, in Ireland, in Canada. The awareness about cancer is, people talk openly about cancer and cancer awareness. It's not a taboo, or it's not like a death sentence. But in Malaysia, that's still a problem.
Why do you think that is? I know people from my kampong who still goes and sees the BOMO or
that's another problem. The what do you call that? The belief about alternative therapies is also very strong. I mean, there's a study from government hospitals saying that 30% of cancer patients are lost from follow-up after diagnosis. That means they don't come back for follow-up treatment and so forth until later, once the cancer has progressed and it doesn't work. These alternative therapies doesn't work. So that's a problem. And then the other message that I would like to personally convey to the society, to the public society, is not just cancer prevention or prevention is better than cure. Early detection saves lives. A lot of these cancers can be detected early using examination by healthcare professionals, screening, and so forth. So once we detect the cancers early, like breast cancer, we can actually cure these cancers. So not just prevention is better than cure, but early detection saves lives. Right. How do we detect early? By going for screening for breast cancer, mammogram and ultrasound, for cervix cancer, pap smears, for colorectal cancer, colonoscopy. Even nowadays we're talking about lung cancer screening for smokers using a low dose CT scan. So we have to be active in this kind of screening programs. And I understand that the government has also introduced some of these screening programs for the B40 group of people, right, which is very commendable. So it's not just prevention, it's better than cure, but early detection. So once we can detect early, we can cure the patients, we can try to change this kind of mindset. Right. So cancer is not a death sentence.
Doc, what's your? We'll have you let you have the last say in this, being the only thorn among the roses.
If you talk about quality of life, I actually have many patients who come to my clinic They say, oh, my friends are all asking me, do I really have cancer? Because I look so well. I mean, I can still go to work, I can still go shopping. And there are also patients who refuse chemotherapy initially. And when they had to undergo chemotherapy because the disease relapsed, there are some who commented saying that, oh, I wish I had done it earlier because I'm quite okay undergoing the chemotherapy. So I think all these myths about all the side effects and all that is not true. So they should talk to this kind of people who have undergone treatment.
It's interesting that you talk about cancer awareness. We don't talk about it. Until a couple of years ago, we now talk about mammograms and how important it is for women to go out there and get their mammograms done, or at least, do self-checking, stuff like that. We already started the conversation. But as of late, there's been a bit of a lull. Why do you think that is? We've got about 1.5 minutes more, very quickly. Dr. Amin?
Yeah, I mean, there's a very important point. We have to talk more about cancer. Cancer awareness is lacking in Malaysia. I mean, the most common thing that they were talking about is smoking for lung cancer. But we are also seeing passive smokers or second-hand smokers getting lung cancer, especially females. So cancer is common. So we need to talk about cancer awareness, cancer screening based on the specific cancers that I mentioned just now. And not just prevention is better than cure, but early detection saves lives. Cancers can be cured if detected early.
Right.
Okay, thank you.
I think awareness programs, October especially is Breast Cancer Month. So there are lots of efforts by the medical side to try and promote this breast cancer screening for people to come. So there are actually hospitals who give out mammogram vouchers for them to come and do free mammograms. So probably in October you'll hear more about this.
Right.
Yeah.
On that note, we'd like to thank Dr. Aminuddin Rahman and Dr. Azura Deniel, one from KPJ Damansara Specialist Hospital and the other from KPJ Ampang Putri Specialist Hospital, joining us right here on Medical Today to talk about cancer care, management and also weak immune system. I hope you've gleaned a lot of information from this conversation. We'll take a short break and come back with more for you right here on Medical Today. Stay with us.